So today we will talk about mediastinum. So mediastinum is a middle space left in the thoracic cavity in between the lungs. So this hole is the thoracic cavity. This is lungs, heart. Thoracic cavity contains lungs, heart, and other structure also. So in the middle of the thoracic cavity we have mediastinum. This is the mediastinum. So it is present between the lungs. So let's talk about the boundaries of mediastinum. So this is the anterior posterior view. So anteriorly we have sternum, posteriorly we have vertebral column, superiorly we have inlet of thorax, and inferiorly we have diaphragm, and on the each side we have mediastinal pleura. So the mediastinal pleura is a fluid. Now let's talk about the division. So in the division, mediastinum is divided into superior mediastinum and inferior mediastinum. We'll talk about the superior mediastinum today. So the superior mediastinum, let's draw an imaginary line from the sternal angle. Here is the sternal angle anteriorly towards the lower border of T4 posteriorly. So this imaginary line is also the inferior border of superior mediastinum. This is the superior mediastinum. This is superior mediastinum. So anteriorly we have manubrium sterni. This is the manubrium sterni, which is the thickest part of sternum. And posteriorly we have T1, T2, T3, T4, and superiorly we have inlet of thorax, and inferiorly we have this imaginary plane. So this is what I told you: anteriorly manubrium sterni, posteriorly upper fourth thoracic vertebra, superiorly thoracic inlet, inferiorly imaginary plane, and each side there is a mediastinal pleura. So in the content we have trachea and esophagus, and in muscles we have sternohyoid, sternothyroid, and longus coeli, lower end of longus coeli. And in arteries we have arch of aorta, brachiocephalic artery, left common carotid artery, and left subclavian artery. And veins we have right and left brachiocephalic vein, upper half of superior vena cava, and left superior intercostal vein. And in nerves we have vagus, phrenic, cardiac nerves, and left recurrent laryngeal nerve, and thymus and thoracic duct. We'll talk about the mnemonics now. So you can easily remember the contents of superior mediastinum by a mnemonic, which is PTV, left battles. P for phrenic nerve, V for vagus nerve, T for trachea, PTV, left for left recurrent laryngeal nerve, and B for brachiocephalic artery and vein. A for arch of aorta, T for thymus, T for thoracic duct, and L for left subclavian artery, left superior intercostal vein, and left common carotid artery, and E for esophagus. So this is the mnemonic PTV, left battles. You can easily remember the contents now. Thank you.